prostate cancer is a very common cancer diagnosed in the United States. Over 200,000 men per year are diagnosed with prostate cancer, and about 30,000 men succumb to the disease ultimately. The cancer is diagnosed generally on the basis of an elevation in the PSA or a change in the PSA, and it's suspected on the basis of a elevation or change in PSA, but the diagnosis is actually made on the basis of a biopsy. There's been a lot of controversy about whether to screen for prostate cancer, and I think that it's apparent to me that screening for prostate cancer has had a beneficial effect, that it has reduced the mortality rate from prostate cancer. But the problem with PSA screening is that it doesn't distinguish those people who have aggressive prostate cancer from those who do not have aggressive prostate cancer. So the flip side of the benefit of screening for prostate cancer and decreasing the mortality from prostate cancer is uncovering prostate cancers that do not need to be treated. So there's a greater awareness right now about who needs to undergo PSA screening, who needs to undergo biopsies, and most importantly, if you're diagnosed with prostate cancer, whether or not you need to be treated. If you need to be treated, surgery or radiation are reasonable options, but if you don't need to be treated, then active surveillance is a reasonable option. Active surveillance is the process of saying, at the moment, you don't need to be treated for your prostate cancer. You're watched very closely with PSAs periodically, examinations of your prostates, and occasional biopsies of the prostate to make sure that the cancer has not grown in size or alternatively increased its grade. And so about 30 to 40% of men who do go on to active surveillance initially will eventually need to get treated, and they seem to do as well as those men who are treated initially for their prostate cancer. Not everybody needs to be treated, and not everybody should undergo active surveillance.